Anxiety symptoms. Signs of generalized anxiety disorder you're ignoring. Have you ever felt your heart suddenly start racing for absolutely no reason? Or maybe you've experienced a strange tightness in your chest, a sudden wave of dizziness, or a feeling that you just can't take a deep breath. Your mind immediately jumps to the worst. Is this a heart attack? Am I losing control? In my years of medical practice, I've seen thousands of patients rush to the emergency room, convinced they are facing a physical crisis. But the truth is, their bodies are experiencing something completely different. Today, we are going to talk about the silent mimic that fools even the smartest of us. We are diving deep into the actual physical symptoms of anxiety, the ones nobody warned you about, and how you can regain control of your life starting today. If you've ever felt like your own mind and body are working against you, you are not alone. Hello, and welcome. I'm Dr. Matthew Harrison. On this channel, we break down complex medical topics into simple, actionable steps so you can live a healthier, happier life. If you believe that your health and peace of mind are worth investing in, I would be deeply honored to have you subscribe to our channel and hit that notification bell. It takes only a single click, but it ensures you never miss a vital health guide, while helping us expand our reach to support thousands of others who are silently struggling in the dark. To truly understand what is anxiety, we first have to demystify where does anxiety come from. It is very easy to look at anxiety as a modern defect, a flaw in our genetics, or a sign of mental weakness. But biologically speaking, that could not be further from the truth. Your anxiety is actually a highly sophisticated, incredibly powerful survival mechanism designed to keep you alive. Millions of years ago, if our ancestors encountered a predator, their nervous system would instantly release stress hormones like cortisol and adrenaline. This triggered the fight or flight response, preparing them to run or fight. Today, we don't run from predators, but our brains still react the same way to modern stressors, like financial worries, relationship issues, or an overwhelming workload. This prolonged state of alertness is what we refer to as an anxiety disorder. When your brain cannot distinguish between a real, life-threatening danger and daily stress, it keeps your body in a constant state of high alert. This is how a general anxiety disorder begins to affect your everyday life and overall mental health. Many people think anxiety is just worrying too much. They assume it's entirely in your head. But as a doctor, I can tell you that the symptoms of anxiety are deeply physical. Let's answer a question I get asked in my clinic almost every day. What does anxiety feel like physically? When an anxiety disorder kicks in, your autonomic nervous system goes into overdrive. Your heart rate increases to pump blood to your major muscles. This can lead to palpitations, skipped beats, or a heavy, fluttering feeling in your chest. Your breathing becomes shallow and rapid as your lungs try to maximize oxygen intake. This is hyperventilation, which can make you feel lightheaded, dizzy, or like you are choking. Because these chest sensations mimic major cardiac events, it is entirely natural to feel terrified. However, understanding these physical symptoms of anxiety helps you realize that your body is not failing. It is simply reacting to an internal alarm. But beyond the obvious sensations, there are also many hidden anxiety symptoms that people rarely connect to their mental state. For instance, chronic muscle tension is a direct result of being in a constant survival state. Your body holds on to stress, leading to a tight jaw, clenching your teeth at night, sore shoulders, and tension headaches. Another major area affected is your digestive system. Our gut is often called our second brain because it is highly sensitive to stress hormones. When the fight or flight response is active, blood is diverted away from your stomach to your limbs. This can cause bloating, nausea, acid reflux, or irritable bowel syndrome symptoms. Furthermore, constant vigilance drains your energy, leaving you with extreme fatigue. You might feel completely exhausted, yet when you try to sleep, your mind refuses to shut down. If you are recognizing any of these signs of anxiety in yourself right now, please take a quick moment to hit that like button. It lets me know this information is helpful to you. If you feel comfortable, please share in the comments which physical symptom you experience the most. Also, if you know a family member or friend who is constantly dealing with these mysterious physical aches, sharing this video with them could give them the exact peace of mind they've been looking for. Reading each other's stories helps us build a supportive community where nobody has to struggle alone. It's important to understand that anxiety isn't a one-size-fits-all condition. There are actually several types of anxiety disorders, and understanding which one you might be dealing with is the first step toward effective treatment. Let's look at generalized anxiety disorder, or GAD. People with generalized anxiety disorder experience persistent, excessive, and unrealistic worry about everyday things, like health, family, money, or work, even when there is no obvious reason for concern. It feels like a constant background noise of dread that you just can't turn off. On the other hand, generalized anxiety disorder can manifest as a constant state of irritability and physical restlessness. Then we have social anxiety disorder. This is far more than just being shy. Social anxiety is an intense, persistent fear of being watched, judged, or humiliated by others. It can make going to work, attending social gatherings, or even speaking to a cashier feel incredibly daunting, triggering a massive physical stress response. Another common form is what we call high-functioning anxiety. Outwardly, a person with high-functioning anxiety looks incredibly successful, organized, and driven. But internally, they are propelled by a constant, paralyzing fear of failure and a need for perfectionism. They struggle to rest because stillness brings an overwhelming sense of guilt and dread. We must also address the intense spikes of anxiety, the panic attack and the anxiety attack. While people often use these terms interchangeably, they have different clinical profiles. An anxiety attack is usually a gradual buildup of worry, while a panic attack is a sudden, intense surge of fear that peaks within 10 minutes. It is accompanied by overwhelming physical sensations like chest pain, shaking, and a feeling of impending doom. Knowing these anxiety disorder symptoms helps us tailor the right approach for relief. Now, we must also acknowledge that life brings specific phases where anxiety can escalate. One area we don't talk about enough is pregnancy anxiety. During pregnancy, major hormonal shifts, sleep deprivation, and the massive life transition of welcoming a baby can trigger intense feelings of worry. It is highly common, yet many mothers suffer in silence because they feel they should only feel happy. If you are going through this, please know that your feelings are valid, and seeking support is the best thing you can do for both yourself and your baby. So, what are the primary anxiety causes? Medical research shows that it's usually a combination of factors. Genetics play a role. If someone in your family has an anxiety disorder, you may be more predisposed to it. Brain chemistry, specifically imbalances in neurotransmitters like serotonin and dopamine, also plays a part. Additionally, life experiences, environmental stressors, and trauma can trigger or worsen these conditions. If this breakdown has brought you some comfort or clarity, please hit that share button. Send this video to a friend or family member who might be quietly fighting their own battle with anxiety. Let's work together to make sure everyone gets the help they deserve. Let's get to the most important part, dealing with anxiety, and more importantly, finding anxiety relief. As a medical professional, my best advice for anxiety is to take a holistic approach. There is no magic pill, but there are highly effective strategies that can completely change how you live. Let us talk about anxiety relaxation techniques. When your nervous system is overactive, you can use physical exercises to force it back into a calm state. One of the quickest ways to do this is box breathing. You breathe in through your nose for 4 seconds, Hold your breath for 4 seconds. Exhale slowly through your mouth for 4 seconds. And hold your lungs empty for 4 seconds. Doing this for just 2 minutes stimulates the vagus nerve, sending a direct signal to your brain that you are safe and lowering your heart rate almost instantly. Another excellent pattern is the physiological sigh, which involves a double inhale through the nose, followed by a long, slow exhale. For long-term anxiety management, regular physical exercise is one of the most underutilized tools for overcoming anxiety. It burns off excess adrenaline and cortisol while releasing natural endorphins that improve your mood. Additionally, pay attention to what you put into your body. High caffeine intake, sugar spikes, and lack of sleep are major triggers that mimic and worsen physical symptoms anxiety. Finally, let's talk about clinical anxiety treatment. If your daily life, work, or relationships are being severely impacted, it is time to seek professional help. There is incredible strength in admitting you need a guide. Anxiety disorder treatment often includes cognitive behavioral therapy, which helps you identify and change negative thought patterns. In some cases, temporary medication can also provide the baseline stability you need to work through your symptoms. There is absolutely no shame in utilizing these medical tools to assist you in overcoming anxiety. Let us summarize this journey of anxiety explained. When we understand how to deal with anxiety, we stop viewing our bodies as broken and start viewing them with compassion. By implementing daily anxiety relaxation exercises and seeking proper anxiety treatment, you can completely change how you manage anxiety. Your body is highly resilient, and you have the power to calm your nervous system. If this video helped you understand general anxiety disorder and your own body a little better, please make sure to subscribe to the channel and hit that like button to support our mission. Don't forget to leave a comment sharing one strategy you plan to try today, or share your own tips on how to deal with anxiety. Your single share, like, or comment might be the exact encouragement someone else needs to read today to start their own journey of healing. Thank you so much for watching. I'm Dr. Matthew Harrison. Take care of your health, be kind to your mind, and I will see you in our next video.